Welcome to Face the Jury, your podcast that focuses on all issues involving medical malpractice, how to spot it, how to understand it, and most importantly, how to prevent it and protect you and your family. This season on Face the Jury, we are excited to have a number of guests that will be joining us to talk about various issues involving medical malpractice. We're going to have clients that we have successfully resolved their cases who will be joining us. I'm going to have other lawyers who have unique experiences and perspectives to offer. And we're going to have doctors and other people relevant to the field of medical malpractice to share their knowledge about medical malpractice and the issues that touch on you and your families. We are very lucky today to have a special lady with us today, Ms. Tammy Wilson. Tammy is one of my favorite clients in the world, and I'm very pleased that we were able to successfully resolve her medical malpractice case at the end of last year for confidential settlement. Tammy is here today to talk to us about her story, how she came to be a victim of medical malpractice, how it changed her life in a very, very profound way. And I'm just very grateful that Tammy's here with us today to share her story and let us know what happened. Tammy, welcome. Thank you for being here with me today.
Thanks for having me, Lord.
Tammy, before we get started in talking about what happened in your situation, tell the jury just a little bit about yourself, where you're from, where you grew up.
Yes, I am originally from Columbus, Georgia. I grew up here. I'm very active. I have 2 children and 1 grandson. Love working in the yard, love planting flowers and doing things like that. But unfortunately, a lot of that has changed.
Well, what I want to do, Tammy, and thank you for sharing a little bit of your background with us. What I want to do is have you take us with you back to November 2017, the day before Thanksgiving. And I understand on that day, you had some physical problems that took you to the emergency room at St. Francis Hospital. Tell us what was going on and how you ended up at the hospital that day.
Yes, sir. Back November the 22nd, 2017, I woke up, experienced some nausea and vomiting with a upper gastric pain. My husband took me to St. Francis emergency room. That morning, I was triaged, given fluids, given pain medication. I couldn't urinate even after all the fluids. So they needed to do a pregnancy test to make sure that I wasn't pregnant. So they did a catheter to get some urine. And once the confirmation of a negative pregnancy test, I had the CT scan of my abdomen done. The nurse practitioner came in and, discharged me with some nausea medicine. I don't know if thinking maybe it was Zofran. I went home, that day, and of course I rest and relax the entire day. But through the night, I was having some pelvic pain. Kind of through the night, I felt my feet getting cold and numb. So that morning was Thanksgiving morning. Around 5 o'clock, I got up. I told my husband I was going to go back to the emergency room because I wasn't able to void and my feet are numb. So I returned back to St. Francis emergency room on Thanksgiving morning about 7 or 8 a.m. I was triaged, informed the nurse practitioner that I saw that morning that I was just seeing.
Just in case our listeners don't realize, a nurse practitioner is sometimes referred to as a mid-level or a physician extender. They have advanced training beyond a registered nurse. And that's what you're talking about. So when you went back the second time, you didn't see a doctor, but you saw this physician extender, nurse practitioner.
Correct.
Is that what you're saying?
Correct.
And take it from there.
Yes,
so
sir.
you're back the second time to the emergency department. Now you're there on Thanksgiving morning.
Yes, sir.
And what did they tell you at this second visit? What did they tell you what was going on?
They wanted me to see a urologist. They thought the problem was a urological problem that I need to see, a urologist that something, was going on. Of course, so then, I was discharged again. So about 6 o'clock that same day on Thanksgiving evening, I I went back to the emergency room for the same symptoms, not able to urinate. My feet were numb. And this time I was starting to experience a little numbness in my vaginal and buttocks area. Happened to get the same nurse that I had that morning. They drained my bladder again. And of course, this time I wanted to go home, with the catheter. And I said, well, do you think there's some type of test, that can be done on me to see why I can't urinate? And she said, no, it's Thanksgiving. The staff is not up to par due to the holidays. Plus, we don't do any images, any x-rays or anything in the emergency room.
So this is three times. I mean, to interrupt you, but I want to make this point. This is three times that you've been to the emergency department in basically a 24-hour period.
Yes, sir.
Including twice on Thanksgiving. Nobody wants to spend Thanksgiving in an emergency department. And it seems to me when we were working on your case that they should pay particular attention to people who are coming in on a holiday, particularly Thanksgiving, where they'd much rather be home with their family. Now, when you were at the emergency room, did you ever see a doctor? And you mentioned a nurse practitioner.
No, sir. I never saw a doctor. No, sir.
So this is now your third ER visit, and you have not seen an actual medical doctor on any of these visits. Is that
correct? Right? That's correct.
So they send you home for the third time. This is Thanksgiving evening. Did you have any idea what was going on or what could be going on?
No, sir. All of a sudden, it just came out of nowhere. I consider myself as being a pretty healthy person.
Sure. So they send you home Thanksgiving night, and they actually send you home with a catheter, with a tube placed in your bladder.
Yes, sir.
And the catheter bag, I believe, strapped to your leg.
Correct.
To collect the urine.
Mm-hmm.
What happened next?
Sunday morning, got up out of the bed and stood up, and I fell. Just collapsed, So I called my husband. He wasn't in the bedroom, and I called him several times, and so he come rushing back there. He picked me up and sit me on the bed.
What did you think was going on, Tammy? I mean, why did you fall? What made you fall?
I was just, clueless. So I have a doctor friend that I worked for several years, family friend now. So I talked with him and, told him what was going on. And he said, you go back to the emergency room. And I said, yes, sir, I am. He said, I'm going to meet you up there this time. And he said, but just in case, because he's a physician, he said, just in case I don't make it there for some reason, you do not leave that emergency room. I don't care what they tell you. You do not leave the emergency room this time. You need to be evaluated. You need some neurological evaluations. This is what OBGYN physician.
Now, was this the first time? And neurological, that just means nerve related. Something's going on with your nervous system.
Yes, sir.
Is this the first time that any doctor or any medical person had mentioned anything going on neurologically?
That's the first time, because when I told him what was going on and that I fell, and he was like, no, you need to, be seen. So, my husband picked me up maybe by my shoulder, up under my arm, and my son had, my legs, and they put me in the car, and I went back to the emergency room. By that time, they had called me back to the back, had assigned me to another nurse practitioner, and by that time, the doctor had came in and asked who was the emergency room physician that was on duty.
Which doctor are you talking about? You talking about the doctor you had spoken to earlier?
Yes, my friend doctor that I used to work for.
And what's his name?
Dr. Sylvester McRae.
So Dr. McRae, has he come into the hospital now to meet you?
Yeah, when I had gotten to the back, he was coming in the same time, and when he asked who I was seeing, they said a nurse practitioner. He asked for the physician. I don't know what he said to the physician because I wasn't, there when he was talking. But then at that time, the ER physician took over. And then they contacted the neurologist, which was on call, Dr. Velati.
And what was going on? What did you, from talking to all these people and these consultations, what did you finally learn was the problem that had taken away your ability to walk?
I had an MRI, several MRIs, had a spinal tap done as well. The physician did the spinal tap, which was an order from the neurologist. I guess he gave them some verbal orders. So by the time Dr. Velati saw me in the emergency room, he came in and, discussed my MRI of my spinal cord and said I had transverse malleus. It was serious and I needed to get treatment ASAP so I wouldn't be placed on a ventilator. And I was just blown away when he said a ventilator. So by that time, my family, my sister, my daughter was all crying and hysterical. And I said, don't cry. I'm going to be okay. And he said, they have a reason to cry. You're not okay.
How did that make you feel?
And he said, you're really sick. You should have been treated with some steroids. The first 48 hours, you miss some critical treatment time period. We're going to have to start some plasmapheresis on you. And it's going to have to come from Atlanta because they didn't even have the machine here in Columbus, nor a nurse that was familiar with the plasmapheresis. So Dr. Velati got that done ASAP so that I can get the plasmapheresis started on that Monday. And so he said, I'm going to put you going to ICU. I'm going to go ahead and start some steroids, but I don't know if it's going to stop the paralysis or not. And just in case it comes to your lung and you paralyze all the way up to your lungs, I want you already in place. And so that's what happened. And I said, okay. And I said, so what am I to do? He said, well, I hope in the morning you don't be on a ventilator. And I said, I hope I won't either. I said, I'm a praying woman. And he said, well, I'm going to tell you, get to praying. And that's what I did. I prayed all night till I fell asleep. And then when I woke up the next morning, the first thing I did was touch my mouth. And I knew that I just wasn't on the ventilator. And I said, thank you, Lord. And I knew I was going to be all right. And I stayed at St. Francis for 10 days before I went to the Shepherd Center. I left St. Francis Hospital on December the 8th, 2017, and I was at Shepherd Center for about almost 6.5 weeks or 7 weeks. But still, when I left Shepherd, I was a little disappointed because they were great. I'm not disappointed with Shepherd or the treatment I received because they were awesome. I was just disappointed that I wasn't walking because I thought I was going to be walking when I left there. So I still came home in a wheelchair, and I was in a wheelchair for 6 months. I made my first step May the 1st, 2018. But in the midst of that, I'm in the wheelchair, not able to hold my bowels. Probably when I got home, about 2 weeks after I got home from Shepherd Center, my bladder started working. I was able to urinate on my own, but my bowel never did return back to normal. I have when I have to have a bowel movement, I have to go right then. I can't wait. I have to go immediately. So whenever I go somewhere, whenever I go out in public, I have to, like, where it depends, depending on where I'm going. I have to take a bag wherever I go. And there's a lot of things I can't do. I can't wear my heels or anything anymore. I have a lot of nerve pain. So it has affected my lifestyle a whole lot. But I thank God that I'm here and I'm doing as well as I am.
Well, Tammy, thank you so much for sharing your journey dealing with this disease. And I want to talk a little bit about the disease and talk about where the malpractice was. You mentioned that you were eventually diagnosed with something called transverse myelitis, which is
Yes, sir.
just a big word for swelling of the spinal cord. And the malpractice, and this is what we put in the lawsuit and was supported by the testimony and the evidence, was that no doctor saw you until you came back for the fourth time. And even then, it took your personal physician, a friend, a colleague you had worked with, who was obviously on Team Tammy and was going to make sure that you were taken care of properly. And it took him coming to the hospital and actually getting the attention of the medical doctor and saying, see my patient, see this woman and take care of her. That always stayed with me in your case, that it should not be that way. And we had a chance to, of course, to take the depositions of the doctors who were working at the emergency department when you were a patient and they never saw you.
Mm-hmm.
And we asked that question, why didn't you see your patients? So, well, we're not set up that way. There are not enough of us. There are too many patients. And there's just not enough emergency physicians to see every patient. So we have to rely on nurse practitioners and physician's assistants. And in some situations, that's okay. If you're talking about a splinter or something, but when you've got a woman coming in who is experiencing a sudden onset of tingling in their legs, numbness in their buttocks, unable to urinate, all of that screams out something's wrong with your spinal cord. It's not a bladder infection. I mean, you didn't, and they evaluated you for a bladder infection. You didn't have any signs of burning or redness or those things associated with an infection. And it just struck me that this is a Thanksgiving. Nobody wants to be working. Nobody wants to be having to call a doctor on call to come in and see a patient and pull him or her away from their Thanksgiving meal. You just sort of fell through the cracks in some ways, but even worse than that is, and this came out in another one of the depositions, all the doctors were like, well, we had no idea what this was. This was so strange and so confusing, and transverse myelitis is so unusual. You can't really blame us for essentially misdiagnosing you. Well, I pulled up Google during the deposition and said, well, let's just do a Google search, okay? And I typed in acute, meaning sudden onset of inability to urinate, numbness in the lower legs, numbness in the buttocks. That's all I typed in. You type in those symptoms and Google produces page after page after page of neurologic diseases, things such as Cauda-Equina syndrome, transverse myelitis, spine, but everything screams about neurological difficulty. So strangely, in this case, you would have been better off if the doctor, the nurse, or whoever simply just Googled your symptoms and they would have realized what's going on, that you've got something neurological. And you touched on how important it is that this be treated quickly. Time is of the essence, particularly when you've got a progressively worsening neurological problem. And but I got to tell you, the most outrageous part of your case, in my mind, is we discovered during your case, we got the text messages between the physicians and between the mid-levels. And there was a text message from one of the nurse practitioners to the ER physician saying, she's still here in the hospital, or she's in the ER. She's got these symptoms. She's back again. And the text message response from the doctor to the nurse practitioner was, get her out of here. Get her out of here. And that's what they did. They got you out of there. They didn't want you in their emergency department. And, that stayed with me in your case, just the level of disrespect. And one of the lessons we see in case after case is that the time of day and the day of the week that you go to the emergency department makes a big difference. You do not want to go to the emergency department on a weekend. You do not want to go on a Friday night. You don't want to go on a holiday, because people are people. And unfortunately, the level of care is not always consistent across the board. So, Tammy, I want to ask you a few more questions if you've got some time with us. When did you decide to look at possibly hiring a lawyer in exploring a medical malpractice case. Talk to us about that process, because I just want to tell our listeners that you share something with almost every client that I see. And they almost always start off the conversation with, I'm not the kind of person to sue. I'm not the type of person to file a lawsuit.
And you're correct, Lord. I'm not that type of person, just looking for a way out or wanting to sue, because I've worked in the medical field all my life for 30 years, But to answer your question, when I saw one of the hospitalists that came up, to talk to me, and he said, "Yeah, I've talked to the admin team about your case, and someone is supposed to come here and talk to you." And so I kept thinking, why are they talking? Why is my case so important? Why are they talking to? Why is the administration is coming to talk to me? And I knew, yeah, I knew that I was mistreated. I knew that there was something more could be done. So it was probably before I went to Shepherd. I said, I think I'm gonna contact an attorney. I contacted attorney Darrell Didell here in Columbus, Georgia, and I told him what was going on. He even came to the hospital to visit.
And then I think Darrell introduced us to each other.
That's correct. That's
And I
correct.
had not had the pleasure of meeting Darrell before that time. And what a pleasure to work with him. For those who don't know him, he is a local attorney in Columbus, handles a variety of cases, civil rights cases, personal injury cases. One of the sort of lessons too is when an attorney goes into some of these smaller communities, or at least unfamiliar communities. I'm up here in Atlanta, although I was stationed down at Fort Benning in Columbus, Georgia, many years ago, and love the town and have a lot of friends there. It's not a local. It's not where I practice law all the time, or at least not as often as I do in Atlanta. And Darrell was the local attorney. He knows all the judges. He knows all the lawyers in the area, and most importantly, for our purposes, he knows the jurors. He knows the jury, the potential jurors that we would likely see on our case. So we worked very well together, and it was a real pleasure working with Darrell, and of course, getting to know you and your husband. Talk to us a little bit, Tammy, if you would, about your experience as a client in terms of the medical malpractice process. And I'd like you to share some of the challenges you faced. I mean, the hardships about being a client and what it was like from looking through your eyes.
The most challenging part for me was that I wasn't able to do the things that I used to do. I was very active, very active in my community, in my church, in my neighborhood, with my family, my friends. And it was a financial hardship because my husband was the only one working. When I was out of work, of course, your PTO eventually run out. I didn't have, any short-term or long-term disability. And that's because I, elected not to, because I just didn't think I would need it. I said, I'm a healthy person, I won't be out of work, for anything. So it was very emotional, stressful, anxiety. It was very, 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 very hard for me to have to change my lifestyle.
Yeah.
And to, get ramps put at my doors and things, of that nature, to come in and out of the house and transferring on a sliding board. My husband had to take me to PT 3 times a week. He would have to leave, come pick me up, break down the wheelchair, put it in the car, put it out. So it was very challenging, and it was, difficult for, my entire family.
Yeah. Well, Tammy, what I'd like to do is ask you, what it's like being a plaintiff. That's the word for the person filing a lawsuit against doctors. And I'd like you to share a little bit about your experience and what some of the more challenging aspects of being a client, whether it's giving a deposition with a room full of attorneys asking you questions. Talk to us from the client's point of view of what that experience was like.
Well, I never liked to give depositions and or being a part of it because it's like any other tragedy or injury. You reliving the process. You're going back through everything, and it's emotional to always have to revisit to think about what you're going through when you're out in the community. Wondering if someone's always watching you. Um, there's nothing wrong with her. I know my appearance may look one way, but I feel a totally different way. It's very, very challenging, to go out, to not know if somebody's watching you, watching your house. If my husband and I go out and go somewhere and eat, should I be out in the community? I felt guilty sometime, like if I go out and about and I'm having a good time and if I'm laughing, having a good time, like, well, maybe I shouldn't. Maybe I shouldn't be out. Maybe I shouldn't laugh. Maybe I shouldn't smile on a picture because I don't know who's watching me.
Well, you're touching on something that maybe a question for folks listening is that you don't think of a civil lawsuit that people would be following you around and watching you, but they do. It's very common in my experience where defendants and the insurance companies that insure these defendants will hire private investigators to follow people in their cars and try to catch you, ideally on videotape, doing something that can be presented to a jury as inconsistent with the story of your damages. So it happens, and I believe I had warned you about that early in the process to be
Hmm.
aware of it because it can be very misleading. Now,
That's
of course, the defense is entitled. They've got a job to do as well. And I will say, in this case, the defense attorneys conducted themselves very professionally.
right. I agree. Hmm.
I was happy to see them treat you with the respect you deserve at your deposition. Sometimes that's not always the case. Defense lawyers can get a little too enthusiastic and aggressive and sort of lose themselves a little bit. That was not the case here. The lawyers in this case were very professional, represented their clients well. And I think that's one of the reasons, Tammy, that we were able to successfully resolve your case. We were prepared to go to trial, of course. Every case we take, we prepare for trial. But I think the defense concluded that that it was better for all concerned, including them, to prevent you from meeting a jury in Muskogee County, Columbus, Georgia, and telling your story, because I suspect their feeling was that the citizens of Columbus, Georgia, would not tolerate the way you were treated, particularly get her out of here. I mean, imagine saying that to anybody in an emergency department, especially one you haven't even bothered to go and examine yourself. So you mentioned at the very beginning that we've developed a very nice and warm relationship, and I've really enjoyed getting to know you and your family. And I say this to all my clients. I'm sorry about the circumstances in which we meet, but
Hmm.
one of the real things I love about this job is meeting people who are just so inspiring. I don't think I would have anywhere near your courage and the resolve that you have shown to recover as well as you have under these circumstances. So you're a very inspiring lady, Tammy, and I just thank you for being here with us to share your story.
Thank you, and thank you for having me.
Absolutely. Thank you for joining us today on Face the Jury. In our next episode, we have a guest lined up, Miss Natalie Kawam and Matt Grant, two people who have been on the forefront of advancing the rights of military service members to recover when they have been victims of medical malpractice. It's an incredible story, and we look forward to sharing it with you next time on Face the Jury.